Welcome. My name is Jose Posada. I'm a senior clinical data scientist working for the Stanford Center for Biomedical Informatics Research and Research IT at Stanford Healthcare. Today, I'm going to be covering with you tutorial 4, part 5 of Stanford Medicine Tools for Healthcare Data Science. Today, we're going to talk about the Node NLP table, a table that contains concepts that has been extracted or annotated from clinical notes. So let's get started. First, how do we generate this table? How are we doing that concept annotation? How are we doing that? The pipeline that we're using was developed by Stanford researchers, and that pipeline also incorporated negation and history detection. But we're going to talk more about what that means in a while. The negation detection algorithm is based off a very famous algorithm called NEGEX, and to detect history, it's based on another very famous and now common algorithm called context. We curate the vocabulary to reduce the number of terms that are ambiguous. An ambiguous term is a term or is a string that may have different meanings depending on the context. We are also populating those concept modifiers that are coming from the NEGEX and the context algorithm to enhance the interpretation of the concepts we are annotating. The main modifiers of interest, or the main modifiers we're annotating, are called history of, experiencer, and negation. We're going to explain in detail what they mean. First, what do you think is a concept modifier? You have some answers here, but what do you think? So what are concept modifiers? Let's start with this phrase and let's dig into that. John is a male with inflammatory bowel disease who have not had biopsy of the intestines or rectum. So first, what this pipeline does is extracting clinical concepts out of that sentence. We are extracting inflammatory bowel disease, surgical biopsy of rectum, and surgical biopsy of the intestine. Those three concepts has a concept associated. In this case, the three of them are SNOMED CT concepts, but those have some particularities. First, inflammatory bowel disease is affirmed, and it is the patient who is experiencing this. Also, when is this patient experiencing this? In the present. Let's take another example. Let's take surgical biopsy of rectum. First, this concept is negated because the sentence explicitly is saying that the patient does not have this. And in clinical notes, it's very common that doctors mention something to rule out in the process that is known as differential diagnosis. Then for this particular one, the experiencer is the patient and is also mentioned in the present. Something that is very commonly found in clinical notes is that doctors may refer to family history and may say family history of cancer. In that particular case, those concept modifiers may be able to identify that the cancer that is being mentioned and that is being mentioned as present does not belong to the patient, but to one of their family members. Second, one of the things that is very important with these pipelines is how do we deal with ambiguous terms? This time we have the word that is called application. That word application exists in the dictionaries with two different meanings. One is an administration of a pharmaceutical product, and the second is a written request for something. The approach that we are taking right now is that we are removing words that are too short. Usually those are acronyms that may have many meanings. Words that are too long, usually those are concepts that are too verbose and likely not to appear on a clinical note. And for this particular case of application, we are usually doing one of the two things. One, choosing one of the two senses to populate the table, but the most common case is that we are actually populating both of them. In that case, you as researcher are empowered to select the sense that make the most use for your particular research application. One of the characteristics of this particular table is that one single node will contain multiple annotations. And the way we're doing to provide you a high quality data is that we are doing only exact string match. This means that we're not using some maybe common techniques to try to expand lexically the word, but using lemmatization or using part of speech tagging. We are not doing any of those features. We are only doing exact string matching, which heavily reduces the amount of matches that we are finding in each clinical node. And we are, for those exact string matches, we are populating the concept modifiers. But what is the case? If I have the full clinical node, why just not do full text search? Here, some of the important aspects. First is that you take advantage of this pipeline that actually already match a high amount of variations for the particular disease of condition that you may be looking for. So you don't really need to come out with a comprehensive list by yourself. If you have the list, feel free to use it, and you have the clinical node and the power of the query full text search to do it. But if done, this method will get you closer to what you want. Also, because these are already concepts, you can use concept sets. So you can expand a concept and be able to look for a wide range of things by using the power of the ontology without you coming in with all the variations, descendants, diseases that may even be named very different, but they depend on the disease that you are actually looking for. But first, let's check how this table looks like. These are the columns from this table. In the bottom, you will find the full specification from the Odyssey documentation. And here, for each concept that we find in a clinical node, we assign a node NLP ID that is unique for just each one of the concepts we find in a particular clinical node. That is the reason that the second column is node ID. It will tell you which node this particular concept belongs. The offset is just the character offset. It's the integer that represents the position to where this particular concept was found. Right now in the star OMOP DID, this column is not populated. Lexical variant is the exact string match of the concept we found. The node NLP concept ID and the node NLP source concept ID are a concepts that are actually found. The NLP system is the name of the NLP system we are using. In this case, it's called TextU2. NLP date time is just the time when this pipeline was run. It has nothing to do when this concept occurs. To know the day when this concept occurs, you need to refer to the node linked by the node ID. Term exist is a flag that abbreviates whether this concept is present, belongs to the patient, and is affirmed. Again, whether this concept is occurring in the present, belongs to the patient, and is affirmed. It is important to note that present is within the context of a node. So present is the moment when the node was written, not the actual time when you are reading the report. In the term modifiers, you will have all the other modifiers at your disposal for you to use. Then we are going to follow with the Jupyter notebooks to see how this table looks like and how to query. Here we came back to the same Jupyter notebook we went over in part 1 of tutorial 4. Here we are saying, what does this node NLP table looks like? Here we're just going to query the 1% data set, and why that is the case. The node NLP table is by far the largest table that we have on BigQuery. Right now has a staggering 33 billion of rows. Because of that, we're going to use the 1% to be able to sift and to get these queries running faster. First, how this looks like. The columns we just mentioned, node NLP ID, that is an integer, node ID. Section concept ID, we are not populating at the moment. Neither we're populating the snippet, the offset, or the lexical variant. One important aspect to mention regarding the Node-NLP concept ID and the Node-NLP source concept ID is that by CDM conventions, the Node-NLP concept ID must be a standard. The Node-NLP source concept ID can be any concept in the Odyssey vocabulary, even if it is not a standard. One thing to notice is that we're actually matching a high number of flowing codes that are actually non-standard and actually don't have a relationship to a standard code. This is important to you to note, because if you use the Node-NLP source concept ID, you will actually find more concepts per clinical node. So how this table looks like? We are using the 1% data set because this table is particularly large. The entire table has more than 33 billion rows. Here, we're going just to select 3 random concepts. Actually, they even belong to different node IDs. And we see the column Node-NLP ID that uniquely identifies each one of the rows, node ID that will give us which node this particular concept belongs, the Node-NLP concept ID, and the Node-NLP source concept ID, which is important to notice that you may sometimes find that the Node-NLP source concept ID actually have more concept than the Node-NLP concept ID because of the conventions. The conventions require that the Node-NLP concept ID must be a standard concept. However, we are matching a large number of concepts that belongs to the long vocabulary that currently do not have a mapping to a standard concept, but they are still being matched. So we suggest that you, if you're not finding what you need, you may actually want to switch to look for the Node-NLP source concept ID. Then we see the flags. Term exists is a string, yes or no, and we see term temporal. We see here right away that this term exists is no, because this particular concept is negated. So let's see how many distinct nodes have annotations. In this case, is 1 million because we are using the 1% data set. So in general, not all nodes have annotations. As I mentioned in another tutorial, there are some nodes that consist in very short span of text, and they may not have any clinically relevant concept. Now let's check where are the top 50 annotations, independent on the modifiers we find. We have concepts such as pain observations. Actually, all those variations are the most popular. Then we have renal function panel. This is in particular for some labs. We have comprehensive metabolic panel. We have serum, blood plasma, and all sorts of concepts that are related to, usually, in this case, clinically relevant terms that are actually found in the clinical note. Then I did it for the Node-NLP source concept ID. You can also do it for the Node-NLP concept ID, and the results will be very similar. Now, as we check the modifiers, you see that the majority of the modifiers we are actually finding here are negations. However, we do find a decent amount of modifiers where the term is being mentioned in the past, and also the term is mentioned to belonging to other that is not the patient. And also we also have a small amount of terms where all that is true. Is occurring in the past, is mentioning other than the patient, and the polarity is negated. For example, one example of this is saying mother had cancer. It's not the patient, right? The term mother did not have cancer. Sorry. It's the mother, is not the patient, is in the past, and is negated. Now, in the next tutorial, we're going to dig into the cohort that we were defining before, and we're going to see how we can use the Node-NLP table to expand our cohorts. In this tutorial, we cover how the Node-NLP table is populated, how to access, how to query, and how does it look like. See you in the next tutorial.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.